Welcome everybody again for the new video. This is regarding the medical education in India and internationally. As we have been speaking for a long, there are a lot of changes which is happening after the national education policy is announced, and post that the National Medical Commission, which is umbrella body for the medical education, is giving lot of different notifications starting from the 18th of November 2021 for the international. And recently, the Gazette notification about the national exit exam has been released. I have been always maintaining that we need to go to the English speaking country, and US, UK, Australia, New Zealand, Canada. These five are the premier countries where the students can go and study, and there have been a lot of regulations that if you go to the United States or Australia, New Zealand, Canada, UK, you can do the bachelor's and master's there, and then you can come back to India. There is no exam. Even national exit exam will be exempted. So that is the Gazette notifications are there already in place. Let's again give a holistic view, because a lot of new changes which has happened. This is the period of admissions, and somebody is saying Russia is good, somebody is saying China is good, somebody is saying Philippines is good, somebody is saying Kazakhstan is good. Now, every counselor or every agent is trying to push its own agenda. But let's understand very, very critically and categorically, I have always been maintaining that whatever is the written document on the board, we have to respect the written document. So let me again go through the basic level of document which we are really talking about. And let me share the screen. So this was the first notification which has come into the forefront. This was the 18th November 2021. Who can really international student can practice in India? So they have given a very, very clear guidelines कि any international medical graduates can come back to India, provided what they are saying. First is they are saying is the minimum duration of the course, medical course should be 54 months. That is a 4.5 years, and the 12 months of the internship. So totally is a 5.5 years, 4.5 years plus 1 year. That is a 5.5 years. Second, the foreign medical degree with medium of instruction, this is the third point, is in English. And the curriculum has to match. And the most critical part, which is there was a lot of confusion earlier, but now it is absolute clarity. Our health minister in the parliament also has stated very, very categorically this point, that you need to get a license of practice in that country. Whichever country you are going, you need to get a license of practice. And if you get a license of practice, that means the quality of that institution should be such that that particular country allows you to really take care of they will allow you to practice. Now, these are going to be very, very critical point. Most of the countries like China, Russia, Ukraine, Georgia, now due to war, maybe Ukraine is, but still some students are gone back to Ukraine in some of the cities. Georgia, which are non-English speaking country. In these countries, the licensing examination is in local languages. Now, theoretically, you may say, okay, I will learn that this language, I will learn Georgian language, I will learn Russian language, I will learn the Chinese language, and then I will crack that particular licensing exam, which is a local. So your education is in English medium. So they will be teaching complete medical in these countries in English medium. And then they will ask you to take a paper in Russian medium. That is a licensing exam part of it. How easy or difficult we will come to know. In India, where the students are going even for the rural areas, they do not know how to properly speak English. And they feel They can learn this examination and they can go and they can really do a really great amount of practice there, or exempt examination, they will take it. Going to be very, very difficult part of it. But still, it is okay. Somebody says, I am a brilliant student, I may do it. Every student is always going to be very, very difficult. For a medical doctor, I have always in all my videos, which is said, if you can diagnose a patient, you can treat a patient. That is going to be a theme of the future medical admissions, even post-graduation admissions part of it. And diagnosis comes from the hospital experience. Unless you have great hospital experience, unless you speak with the patients, it is going to be very, very difficult part of it. And that is why whole of the world is changing. In United States, USMLE has been restructured. UK, there's a PLAB exam. They are scrapping the PLAB exam. They are coming out with the UK MLA exam. Australian Medical Commission already changed the exam. India has introduced now the national exit exam. If you see the central theme of all these examinations, these are the licensing examinations. So to practice, it is a licensing examination. And what is the purpose? Are you a good doctor or no? And what is a definition of good doctor? The most critical parameter is the diagnostic part. It is not how the heart functions or how the kidney functions or how the intestine functions. But if the patient is coming to you, can you treat the patients? And with a difficult exam, licensing exam, which is going to be a local language, think of the medical terminologies. It is so complex. Human body is so complex. Every body part has a different name. In Russian, in Chinese, you are teaching in English language. You are telling the word heart, intestine, kidney, blood, this, that. Pathology has got so many terminologies. And now you have to mug up all these terminologies in a local languages. In Russian, Chinese, Ukraine, Georgian, Kazakhstan, and all different types of language. It is earlier, most of the countries were part of the USSR and they broke into that particular part of it. How difficult it is. What percentage of the student, can the student, even though student knows the answer, he don't know that particular local language that well, or particularly terminology they don't know. Even though they learn the Russian language or Chinese language or Georgian language, it is going to be very, very difficult. We are not even fluent in English today. And that is why it is a very, very risky proposition to go to these countries. I always said it. You need to weigh into this proposition. How many years you will take to really clear this licensing exam is always been a question. But theoretically, considering one day you will be clearing those examinations, I am sure Indian students are very hardworking students. I have faith into that, and they will clear, if not first attempt, second attempt, third attempt. Then the students will come back to India. And earlier there was the FMG examination, MCI FMG examination, which is called. And that examination, if you see, most of the time, the passing percentage is around 10 to 12%. It's a 3 hours examination. 3 hours examination, whose passing percentage 10 to 12%. Only in June 2022, the examination has passed overpassed the 20% range. Different universities, different colleges has got different, but at least around 20%. Still 80 or 75 to 80% students were failing even one of the best passing percentage examination. Now this examination is going to be replaced. This examination is going to be replaced by the national exit exam. Now it is going to be a very, very different scenario, which was earlier a different examinations. And now it is going to be very, very different examination part of it. And let me show you the new Gazette notification, which has come 2 days back. This is a new Gazette notification on 28th of June. This is the Gazette notification which is published by the National Medical Commission. I will go to the English version of that. Okay. So this is the notification. This is a Gazette notification. That means this is a law which talks of the national exit exam. What is the format of national exit exam? It is very, very clearly, I'm showing you exactly the Gazette notification. This is the exam which they talks about. This is a chart which you can see. Medicine and allied, almost 3 hours. Surgical and allied, 3 hours. Gynecology, 3 hours. Pediatrics, 1.5 hours. Ornithology, ornithology, 1.5. Ophthalmology, 1.5. Total 13.5 hours. Currently, FMG was 3 hours exam. This is a 13.5 hours exam. Okay. Every day, 2 papers, 3 hours and 4.5 hours daily for 3 days. FMG examination, which was their 3 hours examination, just 3 hours examination, with a passing percentage of 10 to 15%. Think of now this examination, which is going to be 13.5 hours. Still okay. Indian students are brilliant students. Indian students can come and crack exam. All the individual papers you have to pass with 50%. It is not overall 50%. Previously, all the chapters together. So 300 marks, the examination, you need to get 150 marks, all chapters included. Now here, there are 6 subjects. All individual subjects, you have to get individually 50% marks. It is not overall 50% marks. See, one of the places you get higher marks and one of the subject you failed, you are not passed actually. Then you have to repeat that. The government has given the option of repeating 1 subject or 2 subject or 3 subject. But this examination is going to be twice a year in the month of May and November currently. That may change when the NEET PG, which is going to be the last NEET PG in 2024, will be scrapped. Very, very difficult exam. So if the FMG examination, which is a 3 hours examination, is a passing percentage of 10 to 15%, if you are introducing 13.5 hours exam with individual passing, what will be the passing percentage? So maybe first attempt, second attempt, third attempt, fourth attempt, you may have to take multiple attempts to clear this examination. Once you clear the National Exit Exam 1, this is the National Exit Exam 1, you have to do 1 year of internship in India, in Indian hospitals. That is again a big challenge. Lot of students are not getting internship in India despite clearing FMG exam, because every college, almost 7% of the seats only are reserved for international, because you are local students also doing internship. You cannot say local students, you cannot do internship, and hospital doesn't have the access capacity to do that. And that is why the government of India, National Medical Commission, has a 7% of the students, and many of the students are waiting for quite a long just to get an internship of 1 year, where they will get internship and they will complete it. And then after that, you will do the National Exit Exam 2, second examination. You have to do it. And that is going to be conducted locally. National Exit Exam will be conducted by AIIMS, New Delhi. Think of the quality of the papers. And what the NMC chairman recently has said, okay, it is not going to be a very, very easy exam. This is what you can say. It's a problem solving and analytical, almost 60 to 70, comprehension 10 to 20 to 30. Recall type is only 5 to 15%. No rote learning, he says. It's a clinical. And this examination now is going closer to USMLE. In fact, we expect this examination to be similar level of USMLE examination. NEET PG was very, very easy. FMG was very, very easy. The USMLE was always a difficult examination as compared to this examination. Now it is no. And they says 60% of the questions we must know, 30% to 10% is going to be very difficult. It's a must know questions. So what it is talking about? It is talking about, it is intended to discourage. If you see the read that second point into that. So what is it saying? The first point, to ensure assessment of higher domains of medical learning. Majority of items shall test higher level of comprehension, analytical skills, clinical problem solving that are aligned to competencies. It is not rote learning. Case visits, the third point you read on the screen, case vignettes, clinical case scenario shall be overwhelming pattern of examination. What does that mean? They will give the patient symptoms to you. They will give report, pathology report, other report, 4 options, objective type exam, which is exactly USMLE, UKMLE, and all these examinations are about. Now the National Education Policy 2020 has a highly influenced by the American policy. You will find most of the things similar to the American policy. We had a British policy. They made some changes, few changes into that, but it is main core is of the American education. So now the National Medical Commission or anything will be taking the this American part of it. It is going to be very, very difficult examination. As I said, it is 4.5 hours daily for 3 hours. And then the National Exit Exam 2, which is 100% again clinical examination. All the students, whether it is from the India or internationally, has to take this examination part of it. It is starting from May 2024. It has been already announced. The first examination will be May 24. So those students who are MBBS final year in India or internationally, those will be coming back now. Any student which is coming back has to give this exam. This December, there will be last FMG examination. There will not be all this examination. Now, see the second biggest problem in terms of that. Let's go. This is a chapter about step 1. So step 1 will be objective type examination. Again, this 6 subjects which are there. This is also going to be replacing the final year MBBS examination also. So final year MBBS examination, that is why all 6 papers you have to clear individually, because this is a final year MBBS exam also. It will be replacing. Currently, the examinations are taken by the local colleges. So whatever they teach, they will take it. Now it's a AIMS level exam. AIMS is going to conduct this paper. It will be drafting this paper. And the most critical part, most critical and difficult, even though I believe that you are a studious student, you will do that, you will go to Russia, China, you will study hard, you will learn the language, you will clear somehow the licensing exam, you will come back to India, you will clear the National Exit Exam 1 also, you will clear, you will go into the internship also, you will clear National Exit Exam. I accept you are a brilliant student, you will clear all these parts of it, you will clear all this part. Still after this, can you practice in India? Can you, if despite doing all these things, which is going to be not easy, but somehow you are a brilliant student and you can do it, read the point number 8. What is the point number 8 said? There is no restriction on number of attempts for the next one. What it says, there is no number of attempts are there, provided the candidate has passed both National Exit Exam 1 and National Exit Exam 2 within 10 years of joining MBBS course. Very, very category. In the 3-4 places it is written. You have to clear the next 2 the day you join the medical college in any country, whether in India or internationally. Whether in India or internationally, whenever you join any country, within 10 years time. Now, most of the countries have 6 years of MBBS, because 5.5 years is already National Medical Commission says it should be, medical degree should be 5.5 years. That's very, very, very clearly, categorically it is said. So 6 years which is there. Most of the countries, they finish their part of it in June or July, midway. And then you have to prepare for the, many countries has got 1 year additional post-graduation internship. In fact, the Georgia and all, they will talk about even a residency with PG. It may take 2 years to 3 years additional into the Georgia part of it. Go read the notification from the Indian Embassy, the Georgia part of it. But okay, I assume it is also not there. So 6 years of medical education, you are doing it. Then you are all mugging all the terminology and all. You will try to get, if you are a brilliant student, so in 1 year's time, you will pass that particular licensing exam also. If you pass that licensing examination in 1 year's time, you will pass that licensing exam. I'm assuming it that licensing exam Also, you are a brilliant student. So 7 years. You come back to India. Again, National Exit 1 will take, you are a brilliant student. In 1 year's time, you will pass it. 8 years plus 1 year of internship. 9 years if you get on time. If that internship you get on time, this national exit exam is going to happen twice a year. So if you are clearing in the month of May or June, you will lose 6 months as it is. So 9.5 to 10 months. So if you are able to clear all the examinations in first attempt, if you are able to clear all the examinations in the first attempt, you may somehow try to make it in a 10 years bracket. It is still difficult because 13.5 hours exam, which is a 3 years examination, FMG, with a passing percentage of 10 to 15%, and only one examination in June 2022, which has got 20%, it breached passing percentage. But even if I take the 20-25% passing, exactly the same, what happens to the 75% of the students? 25% pass it. What happens to the 75% of the students going to China, Russia, Ukraine, Georgia, Kyrgyzstan, all these countries? Will they be able to? If you get a second chance to go that, it's gone. It is not possible in completing in 10 years. If the licensing exam, you have been taught in English, and you are taking a licensing exam in Russian or Georgian or any other local languages, it is going to be very, very difficult part of it to clear in the first attempt. It is very, very difficult. It's a very hopeful thinking. Maybe 10%, 20%, 30% of the students may somehow, which are brilliant students, may make up. 70% of the students, after spending 10 years, will be 12th pass. After spending 10 years, you are still at 12th pass. All the money, all the efforts, everything is gone down the drain. And these are exact statistics. So it's a very, very severe. The 8 point, there is no restriction on number of attempts in national step 1 and step 2, but it has to be completed in 10 years for the joining of the MBBS course. 6 years is minimum. Less than 6 years, Gazette notification of 2021 will disqualify you. If any country you are going less than that. So 6 plus you have 4 years just to complete it. It is next to impossible for a normal students to clear it. Many students are going to internationally who may not be very highly academic oriented, or they are not the toppers maybe. They are not a 500, 600, 650 mark students. There are students with 200, 300, 400 marks in NEET, or maybe 60, 70, 80% marks in 10th or 12th standard are going to international universities. These are the students with this Gazette notification, which is very, very clear. It's a clinical. Now, clinical means hospital experience. If you cannot talk to the patient in hospital in local language, you will not gain experience. How you will crack this exam? This is a clinical exam. If the patient says, I got a stomach pain, it may be gases to cancer, anything. It is a diagnostic skills which is being tested, and that requires the hospital. The biggest negative point of any non-English speaking country is the hospital part in local language. Patient is going to speak local language. They are not. The theory is all in English medium. You can complete the theory portion. There is no problem. You are a brilliant student. Even if you complete that part of it, it is going to be very difficult to clear in first attempt. Second attempt is gone. And this is a 13.5 hours of exam, which the paper is going to be set up by AIMS New Delhi. Think of the level of the questions which will be there. It is not rote learning. In fact, sometimes I say rote learning is easy. Rote learning is easy. You prepare that for the exam. You sit in the, burn the oil in a room, closed room. You sit in the closed room with the books and you do it. No, now it is not. You have to be present in hospital to crack the national exit exam. You have to be in hospital, not in a closed room. No books are going to help you now. It is going to be very, very difficult task for that. And according to me, now international education is closed. Only 5 countries which the government of India accept: US, UK, Australia, New Zealand, Canada. If you are going to any of the other countries other than 5, please ensure that you are going for post-graduation to USA. There is another Gazette notification. If you do PG from USA, you can come back to India. That is a separate notification part of it. But still, the 10 years part is going to be a big, big problem. It is not possible now that within 10 years of that, you clear National Exit Exam 1 and National Exit Exam 2 within 10 years of joining. Because the US offers exemption for National Exit Exam. You need not appear for National Exit Exam if you are going to United States. That is why now the things are very, very different now. US has opened the doors. It is the education now coming quite reasonably fees, part of it, far cheaper than in India actually. Cannot be compared with Russia or Georgia or any other countries. US will definitely not that low. I do understand that not every parent has got a money to send to USA. I do fully agree and understand. But after 10 years, if you are just a 12th pass, how it is going to be helping to a middle class family, lower middle class family who has taken the bank loans, who has really paid huge amount of money, which is spent in 10 years. And then you say you cannot practice in India. It is not going. 3 exams, the licensing exam in that particular country in a local language, National Exit Exam 1, National Exit Exam 2. National Exit Exam 2 is also going to be very difficult exam. Do not assume. And these examinations are once in 6 months. So if you miss one of the cycle, you are postponed by 6 months and then you are gone. Again, you are gone. Most of the countries, after 6 years, you have to do 1 year additional to appear for the licensing exam. Most of the countries. Everything is gone now. This Gazette notification, the 2021 notification was challenged in Supreme Court. Supreme Court has really given the clear verdict that is valid now. Now this is a Gazette notification. This was sent to the public. Opinion were sought by the public. A proper consultation process were done. Most of the people have accepted that the 10 years is a reasonable period. When your medical education is 5.5 years, you should be there. But they don't consider the international. It was considered for India. They don't want, government does not want to go to any country which will take. So English speaking country, at least you know new language. You can talk to the patient in a hospital. English, somehow we will manage it. And that is why the countries like Philippines and all which has come, even Philippines degree is not valid in India. But you can still go from Philippines, go to United States, and then you can come back to India. Still you can make it in 10 years. It is possible. Philippines has got a 4 years of MD program. Okay. Philippines has a 4 years of MD program. After that, you enter into the post-graduation. Even if your Philippines MD program in some colleges is 5.5 years, they have increased the duration due to NMC notification, 5.5 years. Then you go to the United States, you complete in the PG part, and then you can come back to India. Still difficult part, but you get a license to practice in United States. At least you can practice and settle in United States. Here you are coming back to India from Russia. You are not settling down in Russia or China or Ukraine or Georgia. US still, it is a great country to settle down. If in case it is not able to complete in 10 years time, you can settle in US. So this Gazette notification with these 6 subjects you can see on the screen, it is going to be very, very difficult. It has got in-depth actually. So 60 to 70%, almost 80 to 90% is the clinical part. Only 5 to 15% is recall type. And that is also 5 to 15% is professionalism, ethics. There will be some questions on professionalism, ethics, and psychology. There are some part of it which will be psychological level questions. And it is going to be very, very difficult. See the type of questions. 1.5 months for a question. Objective type. 13.5 hours examination. This is what is the schedule. So these 2 Gazette notification, my clear recommendation now, do not go to China, Russia, Ukraine, Georgia, Kyrgyzstan, any country, Nepal, Bangladesh, whatever may be a country it is there. Either you take India and admissions are easily available. Somebody with 200 marks also get MBBS admission this year. Next year will be different because next year may be centralized process. Next year onwards, it is going to be very difficult. Don't even think of repeating the NEET examination. Those who have got less marks, don't even dream of repeating the NEET examination. Next year, it is going to be centralized counseling. They may implement this year also. We are not sure. Still, the admission process in India has not started. But because on 2nd of June, they have given Gazette notification. Now in India, it will be centralized process. Already Gazette notification. But Gazette notification implementation date is not set. So there are the many states has said you start from next year. Let's see. But if they start this year is going to be difficult. Internationally is always closed now. China, Russia, Ukraine, Georgia. You can go to the country, US, UK, Australia, New Zealand, Canada. US is the easiest. Those who are 9, 10th, 11th standard, please come to us. You can go to United States in 2 to 4 or 5 lakhs rupees per year fees in the United States of America. If you prepare it early, it is not for the 12th standard pass student. 12th standard pass students will have costly at least 15 lakhs per year. If you are ready with 15 lakhs per year, even 12th standard pass students can fly down in January. But otherwise, if you are in at 11th standard, 10th standard, 9th standard, we have the proper mentoring program. We will build your profile and we will get a premier university far better than AIMS New Delhi in United States, which is a fees which is far, far lower than Indian private and deemed university. Government fees we can definitely not match, but a private colleges or deemed university fees we can definitely match in United States of America. There are many courses in 5 to 6 years after 12th standard. You can become a doctor, gynecologist and practice in United States. There are great product. There are pathway product. There is a 50 student batch in Philippines. You go to Philippines and all the 50 students move to the USA. That is a US batch, international batch. So please understand and check it into that. We will take care of complete education part of it. We will help you. We are career counselors. So now the 2 Gazette notification of 18th November 2021, which already nailed everything. But this was the final thing. Now, please do not waste your money and time and everything going to any of these countries. Please refrain from going to countries. So I wanted to give you the brief part of it as on 28th of June, this notification has come. And it was speculation for many, many years how the NExT will be there. Now it is absolute clarity. It is a US MLE or UK MLE level examination. It is not an easy examination to crack. Few students may crack it, 20%, 30% also. If extraordinary brilliant 20 to 30%, 70%, 75% students, if they don't crack in first attempt, is gone. I'm sure everybody will crack second, third, fourth attempt. That I'm sure, but you don't have time now. Now they are not giving you time. You can take if you fail it, you take second attempt, third attempt. FMG, they are taking 4 attempts, 5 attempts also in FMG. That is gone now. And this is all the struggle is for MBBS. What about the PG, post-graduation? Nobody is thinking of PG. If you are not able to do MBBS, you are gone, PG is gone. Your all efforts, you are after 10 years, you are a 12th pass student. USA giving you PG degree. You are a specialist in United States. Free education in United States. If you take a Philippines degree, you are going to United States, a free PG. In India, again, 1 crore, 1.5 crore, 2 crores for the PG. PG is the very most problem is PG, not MBBS. This year, if there is no centralized admission, 200 marks student will get a purely on merit admission. You come to me, I will give you no donation, no management quota. Purely merit-based admissions. I can give you in India. So Indian student also is going to face national exit exam. So you have to go to good college in India now. Now you cannot go to bad college. You will struggle in India. But even if you struggle it, you will clear it somehow. Because you have 4.5 years of time. So you are not worried about that part. Whereas internationally, it's a double internship. Please understand, international student, they have already done 1 year internship there. And after coming to India, again 1 year internship. Whereas Indian student is only one year internship. It is not a double internship. And some of the students who is gone to the different countries in online mode, they have 2 years of internship after coming back. So they have done 1 year there and 2 years here. Laws are very, very clear now. These are Gazette notification. It's a law. It is not as what Tushar Deoras says or it is what everybody says. Please understand now. Agents are still, their businesses are closed. The agents are still pushing for different countries. This will happen, that will happen in future. They said the same for 18th November 2021. They went to Supreme Court. Supreme Court has stuck twice. And now the Supreme Court order has says, you cannot appeal it now third time. They said, okay, it is enough is enough. Don't come back to us now. That's what is the Supreme Court order. Now, once the Supreme Court says something, and the National Medical Commission says, the government of India says, all three speaking the same language, what agents are saying is meaningless. They may say you anything just for the business sake. Who is going to stuck is you are. Just check, go to the website, official website, and see FMG results. It's really bad results. 3 hours exam, straightforward, objective type 3 hours exam, and you can't pass. The 15% student cannot pass. And now you are talking of 13.5 hours difficult exam, 6 papers. Here it was combined. It was 6 different paper, different passing. Even in one subject you fail out of 6. Is gone that examination, and gone is the 10 years. Very difficult. Don't take the risk now. It's a big risk. If your percentage is above 90%, 95% in 10th and 12th, maybe still I'm not saying you take the risk. You go to USA, that level, you can get even 100% scholarship in United States. Rather than spending 10 years in MBBS. Even if you spend 10 years in MBBS, it is so long MBBS. 10 years for MBBS. And then 3 to 4 or 5 years for PG. You are 15 years, you are just studying. Why? Go take a route which is there, direct American route. US is the best country today, very affordable part. Your bank loans are easily available. You are struggling with the bank loans in other countries. US, you don't have the bank loan problem. Don't ask money from the parents. You can do it in moratorium period. During the PG, is a free PG, you will repay all the bank loans. Study, you have to do it. Hard work, you have to do it. There is no choice. But at least these are English-speaking country. National exit exam is exempted. If you are going to United States, the national exit exam, you need not appear. Think of such a great scenario. So that's what I wanted to just communicate to you. And I'm happy that I'm just recording this. I'll be uploading on the YouTube part of it. And my contact details are there. My website, astuteacademy.com. You can have one-to-one call with any of my counselors or with me. I'll be happy to speak one-to-one and explain these Gazette notifications again to you. Okay? So don't go into the really a motivational speak. Oh, you are a good student. You can do this. You can do that. This is all speculation. You know what level you are doing. If you are not able to get a good marks in the NEET examination, you know, even despite going to coaching classes and all you are struggling into that. And some counselors say, oh, you will make out. What is it in Georgian language? It's an easy language. We will teach you Georgian language. We'll teach you this. We'll teach you that. Everything, there will be tall promises. Everybody will be doing it. You know the reality. I have not seen the students passing the FMG examination. How many students? Even 15% of the students are passing. It is a pass percentage. It is not a first time pass percentage. Maybe only 10% or less than 10%. Many are the repeaters in that. In the 15% passing of FMG. Many are repeaters. It is not every person is passing in first attempt. There is a less than 10% students are passing in first attempt. What happens to 80-90% of the students? We are playing with the life of the student. We are misguiding the students by sending it. Let's be very, very clear. Government is very, very clear. Our health minister has made a statement in the parliament. What more you want? Why we are denying whatever the health minister is saying is wrong, whatever Supreme Court is saying wrong, whatever Gazette notification is wrong. Everybody is trying to interpret in a different way. Why? I don't know. I see no reason why this. Don't go to any of these countries. So thank you very much, and really appreciate. I'll be happy to connect with you one to one and answer any more questions. Thank you.